Hi, I'm Amelia Coulby and I am a young dentist working in Lincolnshire. I've been qualified for 3 years and I studied at Sheffield University. I work in a practice in Grantham, a practice in Lincoln, and I also work in London. Why would you want to be a dentist? If you're a sixth former looking at what degree to do, when you're flicking through the prospectus, it's really difficult to make a decision. And I was you about 8 years ago, so I understand exactly what you're going through. Dentistry is an absolutely amazing career for any young person looking to work with people and just generally help people, get them out of pain. And that is what I wanted to do. When I was your age, I knew that I didn't want to sit behind a desk. I wanted to be practical. I wanted to communicate with people, help them, and that's how I fell into dentistry. Now, a lot of people look at why they would pick dentistry over medicine, and actually, although you think that they're very similar careers, they are completely different. So when you're studying dentistry, it's a very practical degree course, and although medicine has practical elements, it's not as practical as a dental degree. When you finish, you're a fully qualified dentist and you start working in practice straight away. Your first year is under a mentor, so you have lots of help in your first year to get you through. The job that I do is 9 till 5, so I don't do shift work, and I knew that when I was looking for a job that I didn't want to do anything that was out of hours. I wanted to keep it 9 to 5. If you're thinking that you would really want to do shift work, you can work in a hospital environment where you will be working and you'll be on call at night, so there is that element. Now, dentistry is really broad. You might think of your experience of going to the dentist where you just do fillings and cleans, and it's so much more than that. I do general dentistry, which is what you may have experienced, but there's a whole other specialism out there which I've personally chosen to go down the route of helping patients that have pain in their jaws and also patients that have sleep disorders. And you may have thought that you could never achieve that as a dentist, but there are so many avenues you can go down, ranging from what I do to surgery to paediatrics, which is treating children. So if you're a general dentist and you want to do something a little bit different and go down a new career path, that's always available to you. Or from the offset, you can go down a specialist pathway. The other really big incentive is that you are one of the highest earning graduates, so you've done a 5-year degree, you've got a big student loan, you want to know that you can have a job, have a house, have a nice life, and that's what dentistry can give you. Now, that isn't my primary reason at all for getting into dentistry, but it is really nice to know that you've got a well-paid job at the end of your degree, and also the rates at which graduates can be employed are really high. I don't know of any dentist that can't get a job. I think they're well over 95%.